Thank you. Thank you, Mr. William. As we can proceed now with our session, and I hope it will be very engaging and very fruitful discussion concerning prenatal care and maternal health, since it's the one among the public health importance. So we need to dig deep and to dive so that we can be in the place that we can help and serve the world, as well as our families and all that. So before starting, maybe we might be wondering concerning the prenatal care that I know that everyone is aware of it. That's the series of care that the pregnant women are usually provided, and it's a bit of monitoring, since it involves a lot of checkups from the antenatal care and screening, education, and health and other health practices that they receive them from the antenatal visits, and as well as the maternal health. Now it's the whole process from pregnancy, childbirth, and postpartum care. That's after delivery, the postnatal care. And as we proceed now, I would like to welcome our first speaker, Mr. Majani, so that he can tell us a brief, an overview of the current state of a prenatal and maternal health as a country, and how it's a trend and the challenge we are facing currently. Karibu.
Yeah, thank you, Madam Moderator. Good evening, everyone.
Good evening.
Good evening. Yeah, well, this is Edward Majan from St. Francis University, chairperson of Tamsa Medical Student Association here in Young College. I'm so honored and privileged to be in your presence this evening. Thank you for the invitation and all protocols observed. I'm so delighted to share with you for the I'm requested to share and to provide just an overview, just in a nutshell, concerning with the current prenatal care and maternal health at the country, and just a notable trend or any other challenge. Of course, thank you, Madam Moderator, for establishing just a foundation of which concerning prenatal care and maternal health at right. Actually, in the case of antenatal care, as well, you know that just in the medical care that is offered for the pregnant woman, in Tanzania, we succeed to make some progress from the demographic survey that was done very recently, trying to project that in the case of antenatal care, to about 98% of the pregnant women try to visit the antenatal. Trying to get this antenatal care, even to have just a visit also at least once during the pregnant time or the pregnant before delivery. So this way to project there is just a progress beyond compare in the case of antenatal visit among pregnant women. So Tanzania has made the progress to increase this antenatal care average, and the antenatal care service is just a typical provided with health facilities. And even the pregnant women are encouraged to attend just in a recommendable rate, just a minimum of four antenatal care visits during the pregnancy. And the current data try to project that there's just a logic out of it, because we appreciated more than 51% of the pregnant women attend by recommended rate. So this tries to project how far we're moving in the case of antenatal care and its improvement. Again, in the case of maternal health, of course, once you speak about maternal health, what to click in the mind first is the concern of the maternal rate. And concerning the maternal rate, it kind of remains just a significant concern. And from the recent data, try to project that the current maternal mortality rate is 2038. That's trying to project that just a reduction of to about 9.16%. compared with the previous statistical trend. So this way to project and to highlight this kind of improvement in the case of the maternal mortalities. This includes the effort that has been invested and even made to reduce this maternal deaths. However, still we have just a challenge, and the challenge actually is persistence, and particularly in the remote area and rural areas where the healthcare services is still limited. Of course, in the case of the challenge and the trend, we have quite a number of challenges that we have, and actually, this will be just an opening gate to reach the coverage of which or to address. Of course, I will try to project some of the challenges that we currently face. First of all, we face the challenge of geographical disparity, because in rural areas still face the challenge in terms of the access of healthcare facilities that lead to the disparity in maternal health outcome between urban and rural regions. So once you compare between urban and rural region, in the case of assessing this, or you try these services, you will find that just a disparity. So the biggest challenge that we face is geographical disparity, particularly in the remote areas. Again, we face the challenge of infrastructure and resources. To be honest, we have just a limited healthcare infrastructures and resources that resist or just impede the provision of the quality of prenatal care and emergency obstetric services. Again, we have the challenge of education and awareness. We have low level of education and awareness, specifically in remote areas, where can contribute to the delay or inadequate prenatal care. As I highlighted before, that due to geographical disparities and even this remote area afraid to try the antenatal services, now may lead even to the knowledge gap. They are not aware. So the level of education, even the finding, try to highlight that in the remote areas still we have challenge of education that fell most of the pregnant women to fail to attend the antenatal breast, and most of them, they don't understand even the importance of weight, and yet they due to some cultural belief and some norms and customs that already exist in a certain remote areas. Of course, the cultural factor is already the interest factor. Cultural belief and practice may influence the maternal health taking behavior and utilization of health services. Because this cultural aspect, they have a significant maternal health outcome, and even for the pregnant woman to seek for they affect their seeking behavior and even transaction of these services. So it is still a challenge in the health system, and actually we should underscore this. Is still a challenges of these cultural factors. Again, we have just healthcare workers workforce. We have just a shortage of skilled healthcare professionals. However, we advanced it to come up with a skilled basic attendant, but we have just a limited, and the number is kind of limited in concomitant to the people that you are required to oversee to them. So we have just a shortage of skilled healthcare professionals, and include just a midwife and the obstetricians, and this can impact the qualities of care that is provided during the pregnancy and even the childbirth. Again, we have just a challenge. We have just challenge of infectious disease. Disease that we know that is can interfere and even can anemia, malaria, and HIV can complicate the pregnancy and even contribute to maternal health challenges. So, still of this challenge, we're not addressing yet this challenge of malaria and even HIV and even anemia.
And how can we address the disparities to ensure all women receive adequate prenatal care? So, when assessing barriers, we also supposed to know that first thing, we have inequitable and low coverage of health services in countries, developing countries, specifically in Tanzania, including political, financial, and operational and social cultural barriers. So prenatal care is one of the largest services sectors. There is no acceptable definition to access to health care. So Access to healthcare services means the appropriate of individual services to attain the best health consequences. In assessing the barriers to health services can be divided into two categories: supply and demand barriers. The effective factors of demand barriers are inability to use the health services of individuals, family, or society, while supply barriers involves inherent aspects of health system which can prevent the services by individuals, families, and society. So I'll go straight to the main barriers that hinder others to get prenatal care, which is important for to avoid complications in both mother complications and fetal complications. So there is, first I'll start with transportation, distance, and road infrastructure. Fear to, when I'm specifically on transportation, distance, and road infrastructure, most of Tanzanian, geographic Tanzanian has a lot of villages, more than urban areas. So to the villages, we focus on how they get care at these areas. So there is transportation, and especially there is this season of floods. I guess it's a really problem. Distance from their home places to the health services and road infrastructure. With these floods and rain, I guess you can all understand about. Also, there is also attitude of clinical staff, long clinical waiting times. This can also be among the main barriers for mothers to go and seek for prenatal care. When I guess it's so clear when I say attitudes of clinical staff and clinical waiting times. For mothers, they have a feeling that when they go to the health facility, they might succumb such situations. There's also problem in wealth status, that they fear that if they go to seek for prenatal care, they'll have to pay. Most of the Tanzanians are in low income, so they fear that they have to go and pay, and it's going to be exhaustive and it's going to be costly, and they are all scared about the bills. Okay, they also lack education and attainment. Okay, they don't see the importance of having prenatal care. They don't have the education of and there's also I want to talk about in the cost part, they also lack insurance. What if they go it's for free, but they lack insurance? What if there is they go, it's for free, they go and they get tested, and they have to pay for, maybe they have some commodities and they have for their bills, if their bills that are recognized during the prenatal care. So that costs and lack of insurance can make them can bring the barriers for them to attend the prenatal care. So also the ones which are talking like they are called unpredictable costs. Another thing that I wanted to talk about, it was psychosocial problems. They lack support from the family members, for example, the husband. So lack of support can also be among the main barriers to access prenatal care. Also, I would like to talk about how can we address the disparities. So we would like to, as healthcare workers, to provide education to all the mothers through the media, that it's free. For prenatal care, it's free, and every mother has the right to get the prenatal care. And we also have to we should educate on what complications that they're going to prevent the moment that they attend antenatal care. We should also like to suggest how the prenatal care is going to be beneficial to their children or during childbirth, and how can prenatal care prevent death and mortality. Remember, pregnancy is the moment a mother dies because of pregnancy. It's a really bad thing. So when you try to educate through mass media or through just like normal outreach, and you try to talk to the mothers, I'm sure they will have the knowledge, and yet they'll come to the hospital for prenatal care and test. So by saying so, also we would like to ask the government, prenatal care, it's free. Also, there is those commodities that are recognized during prenatal care. For a mother who is pregnant, may they reduce the costs if they have to be attended. And also, we extend the health insurance to rural area. For you should also we extend the health insurance. Saying so, I would like to talk too much. I would like to return the mic to Dr. Jacqueline and say thank you.
Okay, thank you so very much, Daktari. That was very insightful discussion and insightful speech from you. And the thing that I managed to grasp, I'll just pick them in a nutshell, that all of this came from the perception. As we all know that they perceive the severity of the condition of the mother, or perceive what will be the risk and what will be the opportunity after it. So those perceptions that the mother and the family or the caregiver around him, or around her, has, will just foster or will hinder the care, the health seeking care, and having the mood or the morale to go to the hospital or to seek for the right care that she needs.
We will measure the success of prenatal care by understanding the prenatal care coverage per recommended number of visits. Also, we should appreciate the maternal mortality rate. For the measuring success of prenatal care in the maternal health strategy program, we should be able to appreciate the maternal mortality rate. Is it convincing, or just still a burden, or just a progressing public health concern? Again, we should consider in immunization coverage the percentage of newborns receiving essential vaccination. Also, we should consider the issue of contraceptive use. Pregnant women are they using contraceptive postpartum to support just a family planning? The issue of exclusive breastfeeding rate. Also, the maternal health education, the number of women receiving maternal health education during prenatal and even postnatal visit. Also, we should even consider the timely identification and management of complication. As we highlighted before, that there is just number of complication or maternal complication. So we should be able to identify the timely identification in the maternal and the management of those complications, and to be in a position to identify it is quality, and maybe it is percentage of women with pregnant-related complication, and even to identify the proportion of which, and even to be in a position to appropriately manage them. So now we should be able to establish and even to appreciate the maternal mental health, the incidence and prevalence of postpartum depression and even anxiety. Also, we should be able to establish and to appreciate the health facility accessibilities. We are later among the challenges, the geographical disparities. So, for the success of it, we should be able to make sure that we clear the distance and travel time to the nearest health facilities, so that we be sure that maternal health care services are well accessible and even available and affordable. Also, should appreciate the role of the community engagement, the participation rate in the community-based maternal health program, and even the supportive group. So these key indicators are by regularly assessing these indicators and even implement the strategy for sustainability impact, maternal health program can contribute to just a positive and lasting change in well-being of the mothers and even newborn babies. So those are some of the very vital key indicators that we can try to look for the measurement of the success of prenatal care and maternal health. Thank you.
Thank you so very much, and that reminds me of how the progress of the maternal mortality rate and the newborns mortality. It's low. It's going down. We can appreciate on that, and that is the one of the very good indicator when we want to see how far have we gone in health education concerning prenatal care and maternal health in general. Thank you so very much. And now to you, Dr. Mamta. As we all know that we are in a low-income country that receives supports from NGOs and international aid organization, as well as we've got a lot of partnership and collaboration with local governments in give us his people, his community to make a lot of intervention with them. And so now, how can these entities contribute to the strengthening of prenatal care, concerned majorly in infrastructure and services?
Okay, thanks, Jacqueline. As you rightly mentioned, that we do have support system in many low-income groups through various NGOs and international aid organizations. And they are really playing a very important role in strengthening the prenatal care infrastructure and services. Having said this, not everyone is aware about this. So let me just share some areas where they are contributing to the society and how they are prenatal care infrastructure and services. So the very important part of the infrastructure and services which they are contributing is towards the capacity building. So when we talk about capacity building, it is like providing, we all know that it is about providing training programs for healthcare professionals, which includes midwives, nurses, and it is to enhance their skills in prenatal care. So so let me just take you to some in-depth look on the capacity building thing, because it will cover everything almost. So in the capacity building, we not only do the training of the healthcare professional with the necessary knowledge and skills related to prenatal care, but we also go beyond the theoretical knowledge. The capacity building also focus on the practical skills. So the healthcare provider undergoes hand-on training to enhance their clinical skills also, which includes conducting prenatal examinations, or it can interpreting the diagnostic tests, or it can be managing any complications during pregnancy. So as we all know that in healthcare there are lots of development, and so the healthcare professional needs to undergo an update about the same, about the technologies, about the equipment, tools, and how to work on them. So healthcare professional benefits from the opportunity for continuous professional development. They stay updated on the latest advancement in the prenatal care. And not only this, in the capacity building, we also talk about the leadership training, building the leadership skills. Why we talk about the leadership trainings? Because it helps the individual to take the supervisory roles and guide the team how to contribute to the strategic development of the healthcare institution. Now, when we talk about the infrastructure development, how capacity building can also extend to improve the physical infrastructure and the facilities. So this includes ensuring that the whatever healthcare facilities have the necessary equipments, technologies, and the infrastructure to provide the comprehensive prenatal care. So it all covers under the capacity building thing. So they come to know about all the new latest technologies, whatever the tools and techniques are there, what they actually require and what they are lacking upon, so that they can get equipped with the right technology, with the right equipments, with the right infrastructure and the facility in place. And beyond individual skills, capacity building also involves strengthening entire healthcare systems. And this includes improving organizational structures, communication channels, and coordination among different components of the healthcare system. And why they are doing so? They are doing, to enhance the overall efficiency, because if there is no efficiency, there is no meaning of having all these things. And then capacity building also recognizes the importance of engaging the communities in healthcare. So it involves educating communities about the benefits of prenatal care, promoting health seeking behaviors, and they are also involving community members in decision making process, which is related to healthcare. And this makes a very good bond between the community members and the people from the NGOs and the different stakeholders. So there is a good bond and there is a good communication, there is a good relationship which is built, and so things become really very easy. So the collaboration with the local authorities is really very important when we talk about this infrastructure and services, and work closely with the they work very very closely with the local authorities, because it is all the efforts with the existing healthcare system. They have to execute all the local laws which are there. They have to ensure that intervention, that the, any kind of culturally sensitive thing, if it is there, they need to take care of everything. And they also need to take care of that the things which they are developing with respect to infrastructure or with respect to the services they sustain. Because if the things are not sustained, there is no point of having any kind of infrastructure or services. So sustaining the things which are developed, it is also important, and they take care of that. And they also take care of the important integrated medical services, like we can say that quick services, medical services very much required with respect to prenatal cares. So this is all about which I can structure it out for the low income group, and wherein the NGOs and international aid organizations are helping. And these are the challenges also, and these are the some really good initiatives which they are taking care of. So over to you, Jacqueline. But yes, one thing which I would like to add here is, whenever NGOs or international communities are actually doing such kind of initiatives, there are some cultural barriers. So, and there are some kind of belief system, there are some customs, tradition which they need to take care of, which they need to understand and respect, according taking care of that, and then work according to those cases. And also the communication barriers and resource allocation is also one of the barriers which is important to understand and to take care of that. Thank you, Jacqueline, and over to you.
Thank you so very much, Doctor. You're speaking very well, and I don't want to mess around with the content that you gave us. I don't want to spoil or to split anything around it, because it's really superb. And now I would like to welcome member of the floor so that you can pose your question. And I have seen this question concerning the integration of nutrition as one among the factors for prenatal care and maternal. Yeah. Back to this question, that remind me that there is the second webinar. The major topic will be on infant nutrition and breastfeeding. I would like to welcome you all for the next week webinar. That will be very, very amazing, because we will talk about nutrition, breastfeeding practices, complementary feeding, because we see in our community we are kind of like there's a kind of a conflict of interest between the mothers and the caregivers and the in-laws. They want to mix up things, that we have to give babies water, you have to give babies food before that time, before that after birth. So I welcome, that is just in a nutshell of what will be going on in the next week Wednesday. Yeah. So now I'll take this opportunity to welcome the speakers so that you could talk on the nutrition, the integration of nutrition on the prenatal care and maternal health as well. Welcome. Or should I spot a person? Welcome, Mr. Edward.
Yeah, Madam Moderator, thank you. Thank you so much for the chance. Actually, in the case of nutrition, of course, have just an effect on it, but I would love to share. If you allow me, I will love to emergency care and how can we improve it to reduce the maternal rate. If you allow me, I will share that part, if you never mind. And just an experience from the parent.
Yes, Mr. Edward. Thank you for the short experience, and I'll welcome a member of the floor if we want, if we have any insightful comment on the question and the overall comments on the thematic area 2. I mean thematic area 1, prenatal care and maternal health.
Okay, I wanted to answer the question on nutrition and prenatal care. So, on nutrition intervention, a pregnant woman needs to get a healthy diet to provide the necessary nutrients for the well-being of both mother and the growing fetus. She also needs to build enough reserve for necessary nutrients to be used during lactation. When I say lactation, it's during the so the main why do a pregnant mother need a nutritional intervention? Because of the well-being of the baby and the mother too, and together with the nutrients to be used during lactation. So she has to take a healthy diet, but mostly we focus on the iron and folic supplements. So there's some foods that that give up iron. Also calcium supplements like milk. We also restrict some foods like caffeine that may hurt the fetus. Also, we advise them to have micronutrients, especially vitamins. So they should take vegetables, fruits, honey, and sometimes when you just apart from cereals, protein, you should also have fruits and vegetables. So there's this thing that they call recommended weight gain during pregnancy. For a normal pregnant woman has to gain at least 11.5 to 16 kilograms. So how does she gain this? Is through nutrients. So that's how we can interact with nutritional interventions and antenatal care. Thank you.
Thank you so very much, Dr. Dorothea, for the very impactful message concerning nutrition, how we penetrate the nutrition to the prenatal care or to the course of care from pregnancy to postpartum. Thank you so very much. And I saw the hand from Mr. Majani. You are welcome.
Yeah, thank you. Because it just approached the end of the time, I would like to share. Of course, the issue of nutrition is a primary intervention. I do agree in the method of which, but something to share so that we can reflect on the maternal mortality and even how we can mitigate this burden of maternal mortality. To my end, I would suggest if we can have just a comprehensive emergence of obstetric care. This is just a cornerstone of mitigating and reducing the maternal mortality. So just to think to us all, in order to reduce the maternal mortality rate, it's the time now as a nation to come up with strategies on how we can just implement and even come with a holistic approach in the case of comprehensive emergency obstetric care. And actually, we should look around on how we can improve this. Our experience from the field around in my geographical compound, we have just one comprehensive emergency obstetric care, and I can give just a testimony. Of course, we are succeed to reduce the maternal mortality rate to some extent, and the maternal mortality rate is what to project even the quality of the services of certain hospitals, and even given chance to grade the hospitals, and the main focus on the case of the maternal mortality. So, in order to, as we reflect in mitigate the burden of maternal, as a nation to come up with the strategies on how we can improve emergency obstetric services, particularly in remote area. In remote area is very crucial in the case of maternal mortality rate reduction. And I would suggest some strategies that we can employ to do so. Of course, we can start in the case of infrastructure and facility enhancement. Is the time now even to upgrade our facilities and even to equip the health care facilities, especially those in the remote area and the rural area, to provide just emergency obstetric care. So we should make it just a holistic approach, so that we can upgrade some health facilities and centers, so that they can come up, they can provide emergency obstetric care. Also, we can aid or help out in the case of transportation to improve transportation infrastructure to ensure that we have just a timely access to health care facilities for this pregnant women, particularly in remote area. Also, another thing in the case of, we should think on come up with an innovative approach to come up with telemedicine and even to come with the mobile health, and even to circulate around and to help to develop some mobile application that can provide information on pregnancy, emergency sign, and even to facilitate communication between healthcare providers and pregnant women, rather than to wait to come with the visiting antenatal visit. Now is the time we have to come up with the innovation approach so that you can see the mobile platform application around. For instance, from my experience, we managed to develop some mobile application. It's called the Mafia Flex, and even we have just a test and a good feedback from the users. So if you need to hear more about it, you can let me know more. Also, it's the time now to come up with the teleconsultation, even to implement the telemedicine solution to enable just a remote consultation and even advice from obstetric specialists to create the different kind of complication. So if we can employ this telemedicine mobile, can help a lot. Also, we should think on coming with the maternal waiting homes to establish just a setup for maternal waiting home near the health facilities. This can provide just a place for the pregnant women to stay as they approach their due date, and even ensuring the proximity to the emergency care when needed. We should make sure that we come up with emergency transportation, ambulance services, community-based transport, so that we can establish just a community-based transportation system, and even to involve local resources such as motorcycles and even communities, ambulances, so that we can think on mitigate. Another thing is just the task shifting. We can think on delegating the task, and even to look for the quality improvement in your initiative, training, monitoring and evaluation, training management, and even the community engagement. We can think just in a wider lens to come up with the policy and the advocate, and even to come up with the surveillance, and even we can think around to come up with partnership and collaboration, and all just to implement a comprehensive and multifaceted approach that address both the demand and the supply side of the emergency obstetric care. And it is possible to make just a significant stride in reducing the maternal mortality rate in low income setting like our nation, and even to come up with a sustainable solution that require collaboration between government, healthcare providers, community, and even the national partnership to create a lasting positive impact. So by saying so, I would like to thank you all for the chance to share my insight concerning obstetrics at large, and as we reflect on the maternal health. Thank you, and have a nice moment to you all. Thank you.
Thank you so very much. I would like Mr. Saad to be very brief so that we can welcome Mr. William to wind up the session because we're out of the time.
Thank you, Madam Jack. First of all, I'd like to congratulate you. You pronounced my name well. And going on point, I'd like to add up on what Mr. Majani just said, but I'm going to be a little bit different. Throughout the session, we have been talking about what should be done towards promoting maternal health care. But we left out a particular detail, and that is the professionals themselves, us as doctors, pharmacists, and nurses. We are particularly in my country, I have witnessed this in my working years, because we lack professional ethics, whereby we all know that doctors are well versed in diagnosis, while on the other hand, pharmacists deal with medicine and the drugs and with their administration. But in my country, you get such things like in the healthcare delivery system. You get things like in the healthcare delivery system where people who are authorized prescribers are not really well intact with pharmacology, and especially and they end up prescribing drugs that cross the placenta and in turn bring about teratogenicity in the fetus, and hence causing disruptions in the birth, the woman that is going to give birth. So like I would emphasize on each one of us to promote and stand by their professional ethic. It's not about a matter of who knows best and who knows all. It's the matter of does the patient receive proper care, and we are heading on the same direction towards the goal of providing quality health services. So this is just a reminder to us all as doctors, pharmacists, nurses, all other healthcare professionals to stand correct by their profession and not engage in some other act that might bring about future mischiefs as far as people and as a general coverage. Thank you.
Thank you so very much that you incorporate with the interdisciplinary collaboration. Yes, since you are the pharmacist, you have the doctor concerning with the nutrition and all that, we should cooperate together and produce what the community needs us to do and what community wants to see from us. We're doing. We want to see that community and we want to make that community. No one will make that community for us. Thank you so very much. Now, thank you for your time, guys. Thank you for this very insightful discussion. Now, I would like to welcome Mr. William so that he can wind up for us. You're welcome. Karibu sana.
Thank you, Ms. Jeffrey. I hope you can hear me well. So, let me thank all for having agreed to participate in this webinar. It has been grateful and encouraging in such a way. So today's webinar, we had our moderator, Ms. Jacqueline. We had Dr. Mamta Gudial from India. She's all over India, and she agreed to stay until this time. We have Dorothea Atenga from Course. We had Mr. Sad from Kampala International University. We had Hilda Kibonde from Elstokova of Plan International, and we had Edward Majani. So I'm very happy to have this session, and I've carried out things that I'm going to carry them and make them into action. The first thing is the maternal camps mentor that Dr. Mamta said about mental health in the pregnant women. I think if an initiative could be started on mothers to meet mothers and stay with them, it could be a great one. So thank you all for this time. I know most of the presenters be presenting again, but we'll be having another webinar. I hope you guys will be there as audience and even in sharing the more what we have left out. So thank you again and again. I wish you a good night and good evening. Thank you again.